Hello friends, type 2 diabetes happens when the blood cannot use insulin correctly and sugar builds up in the blood. It was once called adult onset diabetes. Over time, high blood sugar levels in type 2 diabetes can damage the eyes, kidneys, nerves, and heart. This can happen because the pancreas doesn't make enough of a hormone called insulin that helps sugar enter the cells. It happens also because the cells respond poorly to the insulin by taking in less sugar during childhood and adulthood. Type 2 is more common in older adults, but the increase in the number of children with obesity has led to more young people with type 2 diabetes. There is no cure for type 2 diabetes. Losing weight, eating well, and exercising can help manage the conditions. If diet and exercise are not enough to manage blood sugar, diabetes medicines or insulin therapy may help. Symptoms of type 2 diabetes often come on slowly. In fact, people can live with type 2 diabetes for years and not know it. When there are symptoms, they may include more thirst, more urination, more hunger, weight loss, tiredness, blurred vision, slow healing shots, frequent infections, numbness or tingling in the hands or foot, areas of darkened skin, most often in the armpit and the neck. Type 2 diabetes is mainly the result of two issues: cells in muscles, fat, and the liver don't respond to insulin as they should. As a result, the cells do not take up enough sugar. The gland that makes insulin, called the pancreas, cannot make enough to keep blood sugar level within a healthy range. Being overweight and not moving enough are the key factors. Insulin is a hormone that comes from a gland that sits behind and below the stomach. The gland is called the pancreas. Insulin manages how the body uses sugar in the following ways. Sugar in the bloodstream causes the pancreas to release insulin. Insulin in the bloodstreams gets sugar into the cells. The amount of sugar in the bloodstream drops. Then the pancreas releases less insulin. A sugar called glucose is the main source of energy for the cells that makes up muscles and other tissues. Glucose comes from the two major sources. They are food and the liver. Glucose goes into the bloodstream. There it enters cells with the help of insulin. The liver stores glucose in the form of glycogen and also makes glucose. When glucose levels are low and the liver breaks down stored glycogen into the glucose, this keeps the body glucose level within a healthy range. In type 2 diabetes, this process doesn't work well. Instead of moving into the cells, sugar build up into the blood. As blood sugar level rise, the pancreas release more insulin. Over time, the cells in the pancreas that make insulin are damaged. Then, the cells cannot make enough insulins to meet the body needs. Factors that may increase the risk of type 2 diabetes include excess weight. Being overweight or obese is a main risk. Second one, waist size. Storing fat mainly in the belly rather than in hips and thighs raises the risk. The risk of type 2 diabetes is higher in people assigned male at birth whose waist measures more than 40 inches. Sitting. The less active a person is, the higher the risk. Physically activity helps manage weight, uses up glucose, has energy, and helps cell take in insulin. Family history. Having a parent or sibling who have type 2 diabetes raise the risk. Age. The risk of type 2 diabetes goes up with age, mainly after 35. Prediabetes. Prediabetes is a common condition in which blood sugar is higher than the standard range, but not high enough to be called type 2 diabetes. If not treated, prediabetes often moves on to become type 2 diabetes. Pregnancy related risk. The risk of getting type 2 diabetes is higher in people who had gestational diabetes when they were pregnant. Type 2 diabetes affects many major organs. These include the heart, blood vessels, nerves, eyes, and kidneys. Managing diabetes and blood sugars can lower the risk for these complications and other medical conditions, including heart and blood vessel disease, nerve damage in arms and legs, kidney diseases, eye damage, skin conditions like bacterial and fungal infections, slow healing, hearing impairment, sleep apnea, and dementia. Type 2 diabetes seems to raise the risk of Alzheimer's disease and other conditions that cause dementia. Healthy lifestyle choices can help prevent type 2 diabetes. If you have prediabetes, lifestyle changes may slow the condition or keep it from becoming diabetes. A healthy lifestyle includes the following: eat healthy foods, choose foods lower in fat and calories, and higher in fiber. Focus on fruits, vegetables, and whole grains. Be active. Aim for 150 or more minutes a week of moderate aerobic activities such as brisk walking, bicycling, running, and swimming. Lose weight. If you are overweight, losing some weight and keeping it off may slow pre-diabetic from becoming type 2 diabetes. Don't sit for long. Sitting for a long period can raise the risk of type 2 diabetes. Get up every 30 minutes and move around for at least a few minutes. If you like my videos, then please like and share my videos and subscribe my channel. Thank you.